Biggest challenge I'm hearing from IT healthcare executives is being able to manage their mobile devices, the BYOD devices, how they can get visibility, what to do, what not to do. So really it's been an educational summit for everybody here. And I think in some of the board meetings, everybody learned off each other, bounced questions off each other, and I gave some insight as well to help recommend best practice, make things a little bit easier.
The biggest challenge I see with healthcare providers is controlling costs associated with data growth.
I think the biggest challenge that we hear constantly today is mobility and security. How to secure new devices coming on their network, what direction should they go, and what provider they should actually pick.
The biggest challenge that I've heard throughout the event this week has been that most IT executives in healthcare today are doing more with less. So they're forced to continue driving the business initiatives within their organization and growing revenue and top line. However, the IT budgets and IT resources are being cut. And this today is really the biggest challenge that most organizations are facing, not only in healthcare, but throughout other verticals as well. One of the things that we see is that simplicity is core to infrastructure and to IT overall. And at the end of the day, that is what provides cost savings.
Well, specific to what we do in the mobility space, a lot of the concern is around compliance and security, providing access to sensitive information. PHI leakage is obviously a big concern, even outside of the mobility space. So I think that we're seeing a lot of appreciation for the fact that we now need to extend our clinicians and give them access to specific tools while they're doing their work away from the traditional acute facility. So I would definitively say compliance and security is a big concern.
So the challenge that today's healthcare professional, both on the payer and provider side, is that they can't see a complete view into the patient life or the patient care cycle.
Our biggest challenge today is healthcare providers and payers have a Dropbox problem. They've got problems with data being shared in the public cloud that are subjecting them to HIPAA violations, sharing patient data in the cloud and running the risk of having that exposed.